Good afternoon, dear patients. Today we will discuss a clinical case involving discharge in mycoplasmosis caused by mycoplasma. A young man came to us who was found to have mycoplasma, specifically mycoplasma hominis. It was present in a rather low concentration. Its concentration was 10 to the second power. In fact, he had already visited various dermatology clinics, urologists, and so on, and had repeatedly been told that mycoplasma at such a concentration does not require treatment. There is indeed a widely held medical opinion suggesting that mycoplasma present in relatively low concentrations does not necessarily need to be treated immediately. However, if the patient is currently experiencing visible inflammatory changes, then it becomes absolutely and critically necessary to treat such mycoplasma infections, considering it acts as a conditionally pathogenic agent or a type of opportunistic flora. It was enough to conduct a thorough and simple examination of the young man's physical condition in the morning, and notice the clearly visible and distinct discharge shown in the photograph. These were taken for a standard microscopy. Under the microscope, accordingly, leukocytes were found in quantities of 12 to 15. This already indicates inflammation. Often patients do not come to the doctor in the morning, for example. They come during the day and so on, when, yes, they haven't urinated for an hour and a half to 2 hours or even 3 hours. However, the inflammatory mucus does not have time to accumulate yet. Of course, to determine whether there are inflammatory changes in the genitourinary tract, it is preferable for the patient to come in the morning specifically. At home, after urinating, a sufficiently long period of time should have passed. Accordingly, in this patient, a direct smear for flora was taken where leukocytes were found. A urine test was done in 2 portions where leukocytes were also found, with elevated levels in both portions, which indicates a total inflammation that had not been previously detected because the patient used to come during the day. A smear was taken to test the sensitivity of mycoplasma to antibiotics, and accordingly, proper treatment was prescribed as needed, including instillations, oral medications, injectable drugs, and so on. As a result, the mycoplasma was cured. What I would like to point out is that such minimal changes, seemingly just 12, 15, 20 leukocytes, and so on, often go unnoticed by modern patients, especially since the pace of life is quite active. However, it is important not to forget that such changes can still cause, as in this patient, total urethritis, which often leads to inflammation of the prostate and prostatitis, and can also cause inflammation of the testicles. Therefore, this poses a significant threat to men's health. Therefore, I would like to point out to patients that even conditionally pathogenic flora such as ureaplasma, mycoplasma, Gardnerella, and so on should be properly examined by a qualified specialist, preferably one who deals exclusively with sexually transmitted infections, and treated appropriately rather than just taking handfuls of random, unclear pills. If you need diagnosis and treatment of sexually transmitted infections, mycoplasmosis, ureaplasmosis, and other hidden infections, you can contact the venereologists at our paid KVD Medical Center in Moscow. We have qualified specialists who focus on the diagnosis and treatment of sexually transmitted infections, including hidden ones. We look forward to seeing you at our clinic, and don't forget to subscribe to our YouTube channel and our Instagram channel. Thank you for your attention.